Hello, wonderful women. It's Dyna Vynk, and we're back for another week of our Facebook Live. And we've got a real treat for you in store. So hang tight, and you'll see what I mean. So happy New Year for people that I haven't been connected with. We had a session last week, but not everyone was there. So this is a particularly important session. We did some extra promotion because this is an important topic for women in perimenopause and beyond. So happy New Year. And, you know, some people have told me that they have made their New Year's resolution to get better sleep. And I thought, okay, getting better sleep is something that so many women in perimenopause want, and they complain about not being able to do it. So, you know, then when I ran into Maria Sokolina, who's our guest today, I thought this is something that we need to explore further. And that's how today's session got started. But anyway, so what I wanted to say about this is, you know, we talk about many different symptoms of perimenopause and menopause in this group, and some of the symptoms are really surprising, right? And we don't talk about them very often, and they're barely described in the literature. So, you know, today we're going to talk about another one of those symptoms connected with wanting to get more sleep, and that's sleep apnea. So I'm so happy to bring to you today our distinguished guest, Dr. Maria Sokolina. She's a dentist certified in dental sleep medicine. Hello, Maria, and welcome.
Good afternoon. Very honored to be here.
Terrific. We're so glad you could join us. I just want to tell you a little bit about her background because it's pretty special. Now, Dr. Maria Sokolina is a founder and CEO of Harmony Dental Arts. She emigrated from Russia with a medical degree and then later received her degree in dentistry from New York University College of Dentistry. And then after graduation, Maria pursued some special skills in different areas of dentistry, like implants, like cosmetic dentistry, full mouth rehabilitation, and orthodontics. And Dr. Sokolina is also a lecturer and a diplomat of American Academy of Dental Sleep Science. So she's a bit of a rock star, and she's also been acknowledged as the best dentist of New Jersey in 2015 and in 2017. So this is quite you know, an impressive resume, and with all those different attributes, I'm wondering, how did you come to this interesting specialization that combines these, you know, sleep disorders with dentistry?
Yeah, that's you know, I'm honored to answer that question. Yeah, I've been a searcher, I've been a constant explorer of dentistry, and as a lot of things we do them out of fear. I really want to create a beautiful dentistry and not to face my failures. You know, it's a very like internal desire. You create something, you work on a project, then patient come back next day. Oh my God. So, you know, out of that, I start exploring, why people break the restoration. People talk about TMJ. I have pain in the jaw joints and I squeeze my teeth. I grind my teeth. And I was wondering why, or what can I do to prevent it?
Yeah.
So I start working, you know, of course, to find the second exit, you know, working on the implants. Yes, I can do the implants, but implants can fail as well. That's what I learned. So what can I do? How can I protect my work? And I start digging deeper. At certain point, I come to the orthodontic course because I realize people, when they have a bite wrong, they do the forces extremely strong. So I want to correct the bite to create a good system, failure-proof system. Mm-hmm. And on that course, I realized, okay, now I create a failure-proof system, but people still can break the system, still can break the restoration.
Okay,
I got a step further, and one of my friends, actually, Dr. Vedel, I have to give a credit to her. She said to me, why don't you learn about dental sleep medicine? It was just the beginning. It was many years ago. I've been doing that. It's going to be 15 years soon. And I got into the little mini residency program and learned about the sleep. And it was such a revelation because pieces of puzzles, what I've been fighting with, start coming together. I realized, yes, if you don't have a good night's sleep, and thank you, Dyna, for inviting me today, because you're ambassador of a good sleep. If you don't have a good night's sleep, nothing gonna work.
Yeah.
Not the hormonal things, blood pressure, heart disease, everything gonna come together, as well as your smile, as well as the dental restorations. And it's not as simple as I say it in my short overview of my life story,
No.
but I learned most important thing, what form and function, they are connected so well. Function defy form. And with the sleep, again, sleep was actually like a pinnacle of all my studies. And I thought, okay, if I'm gonna address that, then maybe I'm gonna have a failure-proof system in my general practice. Yes, I learned that specialties, and I've been really impressed how science moving into that direction and how I can help people in that direction. I can logically explain a lot of unexplainable things to my patients, because I always root for the root cause of the disease, not just face on the top, do a little makeup and it's gonna break next day, but really create a system and explain before I even touch the patient, before I even start. It's going to be this way, that way, that way. We can go to that direction, that direction, and in the end, you're going to have this or you're going to have that. That's my story.
Right. Yeah. Well, and of course, sleep is so important to our bodies and to our health. But I don't think a lot of people connect it with things like dentistry. So, the fact that it is so prevalent, but it does take a holistic approach to look at, to be able to see these connections. So that's terrific. Now, there are some myths associated with sleep apnea, and I'll tell you what mine is. Mine is that it would be sort of a middle-aged man, perhaps a little bit overweight, and they would do a lot of snoring, and that this would interrupt, this would create a sleep apnea situation. But I'm guessing that that's not entirely accurate. What do you have to say?
It was a wonderful picture. And when I just start, exploring dental sleep medicine, it was exactly that picture in my mind. Mm-hmm. Middle-aged, overweight man with most likely, cardiac disease associated with that, high blood pressure, severe grinding habits, bruxism. Yeah, this is my patient.
Yeah.
Just to explain how my practice works based on the referrals. I do I do suspect certain sleep apnea patients in my general dentist practice, but most of my sleep apnea patients come to me from referrals of the other doctors. And I was really shocked. How come, that picture in my head, overweight, obese man, doesn't look like that in the reality? I was totally shocked. Petite, really, with a good physique, females, they come to me and they said, here is my sleep study. And I look at them and they look just like me, and I was just so shocked. Like, that was not what is in textbook. But yes, I see them. They're suffering. They have symptoms. And it can be male as well. And he doesn't have to be overweight, obese. No, he would be, going to the gym every day. I have a lot of people really, who really distinguish
really
in
active.
Sport. Yes, very active, or have a career in this professional sportsmen. And you think, oh my God, if I go to the gym every day, no, that's not what's gonna explain me. I was always looking what exactly answer to my puzzle. Now, after practicing so many years, I can see a lot of things like through the magnifying glass. It's not a right picture. If it's in the media, you've been a great ambassador and I'm trying to promote the idea. No, it's not. It's, yes, of course, those people are suffering as well who fit to the description. And Charles Dickens, he was the first one who described it. But no, there are a lot of other people who don't look like that and might have a totally different medical history, because sleep apnea associated with a lot of other disease. They might suffer from sleep apnea. And the reason why I'm trying to promote, that's a good idea to start with a sleep study if you're concerned about your sleep.
Yeah, you're right. Now, the symptoms can be really different in men and women, right? And this can mean that women aren't well diagnosed, and this is a common problem, that women aren't well diagnosed. But with sleep apnea, there's extra mystique here. So what is the difference, and what are the symptoms for women?
Yeah, that's a wonderful question what you touched. Yes, with the male, it's a very, classical symptoms. We're talking about snoring, gasping for air, but most of the males, they come to my practice because wives or partners trying to save them. They
Yeah,
are great life savers. And now, I meet with a lot of families. I have a consultation with the family because female is always a driving force.
yeah,
My darling, you have to visit the doctor. Oh, please visit the doctor. And I'm going to be with you on every step of the way. But very often during those conversations, we discover, but it's not only one person in that unit suffer, actually two. Of course, sleeping next to the snoring partner, it's another terrible story.
that's a problem. Yeah.
It's a problem, lead to a lot of depression and anxiety. That's constant sound during the sleep. Yes, it's not healthy at all. And yes, it's good idea to use the, earplugs, but, a lot of other parts of your body still sense that. So that's not the answer. But for females, symptoms are very different. A lot of females, they complain on being anxious, being depressed, being fatigued. And, of course, we all, living in our time frame, we always have all of that. But it might be a little bit more serious than just, anxiety. It might be sleep apnea. And again, I'm a big proponent to know your map, to have a sleep study, to see what exactly you have. How's your oxygen level at night? What's the variability of your heart rate? Isn't it really you sleep at night, or you're running a marathon but in bed?
Yeah.
Or maybe it's not the depression, because somebody upset you at work. Maybe you just don't have good restorative sleep. You don't give a chance for your brain to release the actually sex hormones or any type of hormones during the slow wave sleep, or you don't give your brain to restore, to consolidate your memory during the REM sleep.
Yeah.
And if, thank you, Dyna, again, if listeners of your channels have any suspicions what the sleep might not be good, but they wake up in the morning with a headache, that's the female symptoms. I have a headache in the morning. Or, maybe I have a headache right here. Maybe I grind my teeth. I squeeze my teeth, which is also a symptom of the sleep apnea, because when you don't have enough air, you move your jaw forward to open your airway. Your body is very smart, trying to protect you. If you have all of that, no, it's not just a night guard. I don't do just the night guards anymore. I always ask my patients to check the sleep, because if I put just the night guard, I occupy the space for the tongue, and tongue now gonna go into the airway and block even more. Yes, you protect your teeth with the guard, but you block the airway.
Yeah, that's not a solution then.
That's not a solution. Yes, women have a different symptoms. And sometimes it's not that often what men mention in the same way to females about the snoring.
Yeah.
And the snoring is not a ground for joy. It's just your body tell you something. And there is a wonderful application on our cell phone called SnoreLab. Or, there are a lot of other besides SnoreLab, but I use SnoreLab a lot in my practice. You can record yourself and listen to yourself, because your best advocate.
No, that's a good tip. Yeah, terrific. Now, women in perimenopause and even, into menopause are more likely to struggle with sleep apnea because of a change in hormones, right? So drops in estrogen can affect the resilience of the tissue. It affects the resilience of muscles and bones and, skin and whatnot, but also the tissue in the throat. So how does this affect breathing passages?
Yeah, the estrogen is such an important factor. Yes, we are protected until the certain age with estrogen, of course. And the drop in the estrogen make us even more serious towards sleep. We
Yeah.
have to be more aware, and we really have to do something. And I would say double way, because from one point, yes, with the perimenopause and menopause, drop. But also, if you don't have a sound sleep, you don't have chance for hormone to get released. And
Right.
even if you're not in that stage of life, you can
Yeah.
still have the same effect, because not enough hormone from not enough
Enough
sound
sleep.
sleep you
Yeah.
have, like, it's a double trouble.
Yeah.
But yes, it's very important. And also that's the practical observation I have from my practice. When when women are pregnant, you can have sleep apnea as well. It's
Okay.
a more anatomical and hormonal combination.
Right.
But that time women start snoring, and that can be disbalanced with the oxygen, which definitely affect the babies. It can be
Sure.
low weight. I know it's not the topic
Yeah.
of this channel, but some people might go into pregnancy and might get surprised with the sudden snoring. That snoring need to be addressed. Don't leave it. You can have different types of, and have a healthy pregnancy and delivery.
Oh, we're starting.
But especially for perimenopause, and can you hear me?
Yeah, we lost you for a second, but you're back.
Yes, it's really critical, and it's a great question. On any stage of life with estrogen, it's very important hormones which protect us. Nature gave it to us, but when nature start taking it away, you have to do something about it.
Right. Good. Okay. Now, has HRT been shown to help with sleep apnea? That would be, a lot of women in perimenopause and menopause could be taking that. Is that part of the solution?
Yeah, there are some studies what they show what HRT decrease chances of sleep apnea, or might change the stage of sleep apnea, because sleep apnea have a different grades. It can be mild, moderate, or severe. And HRT, yes, tissues become more resilient. It's better for this specific disease. I absolutely agree. I always agree with action rather than no action.
Yeah. Okay.
So answer is yes.
Yeah, so that's another vote for HRT that comes from a completely different area, right? That's a completely different reason why you might want to take HRT. Yeah. Now, I believe there are a couple of different types of sleep apnea. How does that work?
Yeah, there are different types of sleep apnea. There is a central sleep apnea, and obstructive sleep apnea, and mixed sleep apnea. Central sleep apnea, it's a very complicated story, and it's mostly related to some, I would say, severe health complications. Congestive heart failure, it can be Alzheimer and Parkinson. It can be severe hormonal disbalance disease. And most of the cases for central sleep apnea, at least what I've seen, after age 65, even though nothing in medicine is always straight line. But central sleep apnea, like just central sleep apnea, it's related to the brain regulation, and it's a complicated story, and it's not scope of my practice. That disease got treated by pulmonologists specializing in sleep with a BiPAP, CPAP, or a special machines what activate, and they have to do a lot of breathing for you in those moments when brain doesn't give a signal for the human body to breathe, for lungs, for diaphragm, so this is central. And another type, obstructive sleep apnea, that's the sleep apnea what I deal the most. It's related to obstruction of the airway on a different level. Right. 70% of the cases, it's obstruction with the tongue.
Okay.
Tongue into the airway, and that's the common source of obstruction. And we can talk about that a little bit further. But also it can be tonsils, It can be uvula. It can be collapse on any level of the airway. And another sleep apnea, what I see very often, it's called mixed. It's a combination of central and obstructive. So, I would get the sleep study and I would see the, X amount of obstructive episodes, and I would see X amount of central sleep apnea. And from my practice, a lot of patients had experience with the CPAP machine, and we didn't even start talking about treatment of sleep apnea, but they was not able to really be compliant with the CPAP machine, and they got into the oral appliance pathway. And very often when I address sleep apnea, obstructive sleep apnea, mixed sleep apnea disappear as well. So sleep apnea still have, it's not a clear map. There are a lot of white spots, what we don't know yet, but that's what I see in my practice.
Okay, so it's an emerging picture, but what you're seeing 70% is obstructive sleep apnea, and so
70% obstruction with the tongue.
Yeah. Okay. Good. So it's good to know about that. Now, for obstructive sleep apnea, there are some things that we can do about this without having an in-person visit, right? Can you talk a bit about what we can do about this?
Number one, you have to get diagnosed. And in-person visit, like right now, and especially after COVID, world change. And, for some people, it's very comfortable to do a lot of things in the comfort of their home. There are different aspects of that. So to diagnose obstructive sleep apnea, you need to have a sleep study, and you need to have a visit or virtual visit with a sleep specialist. But the visit with the sleep specialist, as well as sleep study, can be done. Sleep study can be done at home. You can order the monitor and it's going to be delivered to your home. And a lot of people, they suspect sleep apnea, but they don't do nothing about that because they're so scared to have a sleep study done. They're really scared to sleep in an amount of wires. They don't have a good sleep, and then sleep in an unknown situation make them really like, no, I'm not going to do it. And even thinking about CPAP machine, I don't want to do that, but it's not true. I have a channel, and on my channel, I interview different sleep study, representative manufacturer. Now you can have a sleep study done just with a ring, something on your finger, or with a bracelet called watch pad. And that's called night owl. Or you can have a band on your head. Yes, you can have 3-channel also for home sleep study. They're like different designs of the monitor, really devoted to people who cannot sleep with a lot of wires, not at home. So you can do things at home and find the way what's going to suit you. There are a lot of options. Then, yes, you need to have a visit. It might be virtual visit with a sleep specialist, and he will prescribe the treatment. Now we're talking about treatment. There are different ways of treatment. Standard of care in the United States and in Canada is a CPAP machine. But the compliance towards that treatment, that's the irony of it, very low. People start, it looks so good on a sleep study, but if you have to put it on every day, a lot of people
just don't want to use it.
No, they keep it in a closet, they have it, they don't use it. For a lot of insurances, if you don't use it at least 4 hours every night, the insurance company take it back. So it's like, it's a totally different image of yourself with that machine. You little bit look like an alien. So it's really take a lot of will to do this treatment. I highly respect the treatment, and people who use that treatment, when I offer them my treatment, I do the treatment, a lot of treatment with oral appliance therapy, not just oral appliance, but oral appliance therapy. Yes, that's, specific treatment what's require visit to the office at least to start. The rest of it can be done on Zoom. I have a lot of virtual visits on Zoom. And additional to that, now we're talking about almost fully virtual treatment. We add myofunctional therapy, the special therapy for the lips, tongue, swallowing, that can be done also virtual. That's to strengthen the muscles, but they still stay resilient at night, and airway does not collapse at night, and you don't snore. That we do a lot virtually. We do that training virtually. People do the homework, we check, and we get a good results with that treatment, which require a lot of will. You really have to be disciplined. You really have to believe you can do it. But in the end, your breathing, which has to be through the nose, we establish the breathing. We try to establish the breathing through the nose, which is very, very important. And I find that most of my patients who suffer from sleep apnea, they don't use the nose.
Right. Yeah. Yeah. So that's a big shift. Well, and that can mean that couples can get together again, right? That they can sleep together again.
That's very important. I have
Yeah.
the most noble job in the world. I try to put people back together in a bedroom.
Yeah. Yeah. Yeah, that must be very rewarding to have that happen. And for the people involved, sure, it takes a will, but that's the case for just about anything you want to do, right? You have to set your mind to it, and then you get some really good results. And particularly if you weren't clear what was happening in the first place, right? If you had difficulty diagnosing the problem, you just knew, I feel terrible. And then to have this kind of a solution, it's well, it's wonderful to have this.
I think, I'm so sorry to interrupt you, but I really thankful what you give me ability to talk, and what, my words might be, important for a lot of people. You just have to be aware of what you have. You have to kind of own what you have and have a desire to have some actions. And with people like Dyna, who, really good liaison between you and the disease, that's helpful.
Yeah. Yeah. Thank you. Right. Okay. Well, that has been really terrific information, Maria. Now, how can people get in touch with you to find out more?
I would personally recommend, you have my name. My name is Dr.Maria Sokolina. And if you Google Maria Sokolina sleep, you will get, that's the easiest way. And I have a wonderful team behind me. Of course, I'm not alone. I have a great team who support my mission of making this world a better place with this sound sleep. Also on a social media, I have a channel where I put, a lot of information, maybe not such a regular information, something what I personally research, and I meet with people, and I believe in a technique what people do, and I interview them on my channel. It's called Sleep Apnea, Snoring, Breathing Help. And thank you, Dyna. You're going to put the link in the chat. And you can find through the website, and we have a chat there as well. So there are a lot of different ways we can help you. And if you're distant, if you're not in the United States, it's totally not a problem. We would be very honored to connect you with the people, because I'm on the board of American Academy of Dental Sleep Medicine. And I know a lot of people who practice the same way in Canada or almost in any part of the world, because they all come into our academy, and I meet them either virtual or in person on a conference. I can connect you that way. So I would be very honored to spread the word about this philosophy and help you.
Terrific. No, that's wonderful. Lots of different things there. So I'll put the link to your website and to your Facebook group in the chat so people can check it out. And so thank you so much for joining us and shedding some light on this, this area that I think people will be really keen to hear about. And, another thing to diagnose and to determine why they're feeling so badly, and provide a path to wellness. So thank you so much. And to the listeners, if you have questions, please pop them into the chat. And I'll be happy to answer what I can. If there's something that's in Dr. Maria's corner, then we'll make sure that she gets tagged so that she can answer it. But we want to get this information out and to empower you to make some investigations and some decisions.
Thank you very much, Dyna.
Well, thanks for joining us, and we'll take care. We'll see you next week.